Cohen-Hour, and I'm a physician. I've been involved with Gennesaret ever since I was finishing my residency, so almost 25 years, I think, or maybe even a little more. About 3 years into Gennesaret I was in my residency, and Dr. Trippi came and spoke to us at a lunchtime meeting that we had. Most of those lunch meetings were pharmaceutical companies trying to convince us to buy something, but he came to talk about how we could give something back, and I'd always been interested.
When I reached out to Rebecca and I got introduced to it, I was struck by specifically her and Dr. Trippi. And I wasn't sure what the Gennesaret mission was and where it fit in my life, but I was intrigued because they impressed me so much.
Yeah, and I mean, it was an interesting opportunity. Dr. Trippi and Rebecca had this vision for starting the health recovery program for men, and it was right up my alley of starting a new program, doing something that I was pretty passionate about, which is helping those uninsured and underserved. And once I started to learn about the Gennesaret story and what they were about and the evolution they were going through, and that they were looking to expand and really open this unique program, actually the first in the state of Indiana, it grabbed my attention. So I feel very fortunate that I was able to help them realize their vision. And we've been very fortunate, Gennesaret, over the time I've worked there and as a board member, to have the support of a lot of different individuals and organizations and the hospitals that we work with, resources that are being provided. And and we do a lot with a little. And Gennesaret has continually shown, we're now over 25 years that we've been able to change with the times. We're definitely filling a need in the community. We're definitely filling some gaps, if you will, in care that are needed. And certainly the healthcare system's changing, but Gennesaret has found a way to be there to support folks who are definitely in need of care and services.
A typical patient is someone that's on the streets, that's coming from the traditional shelter where they're not living there. They're hanging out on the streets, they're in an abandoned building somewhere, they're at a campsite in the community somewhere. They're unfortunately kind of resistant to coming in off the street because they're not comfortable conforming, become injured in some way, or they have chronic health problems where they have to go into the emergency room and they subsequently end up going inpatient. And so to get into our program, you have to be an inpatient. You have to be referred by an inpatient case manager, nurse practitioner, or someone at the hospital. And so once our guys come and recuperate, then a part of my job is to try to find them housing if they're interested. And that's kind of where the social work role comes in. Not so much on the as their director, but once they are ready for discharge.
Initially, it was interesting because I'm not the poster child for a supporter of Gennesaret. I own a couple of companies in Indianapolis. I am a kind of hard charger in the sense of I love business. I love growing companies. I love putting deals together. As someone who is a big believer in accountability, a big believer in making decisions and then benefiting from or suffering the consequences, my impression of it has evolved. What started out as kind of a curiosity and a strong impression with its leadership has turned into a broader understanding about people and about myself. Gennesaret for me is about finding the heart in myself to balance my own broader mission.
I think another thing that's been unique, in my time with Gennesaret, we opened the Blue Triangle Clinic, which was, I think, a big success. That really became our flagship clinic. We have a dental clinic there. We provide lots of different services, primary health care services there that folks can come in, and that's really their patient-centered medical home where they come in, and that's their trusted place where they receive care. So they know that we're going to be there for them, and we'll provide them access to care where they have trouble getting access to care in other ways. So I definitely, in my time in Gennesaret,
And so over the years, I've recruited a number of students from Butler, And many of those have graduated, have gotten married, and then I've gone, well, they're probably going to stop volunteering. No. And then they have children, and I go, now they're going to stop. No, they still continue, because it's got to become a part of your heart. And the reason I try to get students involved is because you need to make a place for it in your heart. Everybody has 2 or 3 hours a month that they can give. And
I
it's
believe the
not just
biggest need for Gennesaret right now is for more resources for dental services, which I don't work with the dental services. I am just with the Women's Health Initiative, but my office is in the administrative office, so we frequently get calls, and I sometimes answer the phones there, and invariably the majority of those calls are people searching for dental services.
Okay. You know, one of the exciting things that's happening with Gennesaret right now is the Women's Health Recovery Program. And it's another example of an organization and leadership. And I'm talking about Dr. Trippi, I'm talking about Rebecca, who identified an opportunity. The city came forward with a property that had certain restrictions perspective. Gennesaret we've been talking as a board for a number of years about mirroring our men's program on the women's side. And watching how that evolved, watching how the team kind of jumped in, assessed it quickly, evaluated the opportunity, determined what the impact would be on our organization as it is today, and what difference it could make in the community. It's a great
I think that although we're a small organization, we have such great impact. And that can be just as important as the big organizations that touch many people. But particularly for my program, where I do a lot of one-on-one contact with people, and if they need a ride, I'm going to go get them, or I'm going to call a transportation service and make sure they get that ride. Big organizations cannot do that. One, because they just have too many people and they don't have that close contact with each other. And then, one of the things I think about often when I think about my time at Gennesaret is when I first started working, and I want to kind of stay on top of things, so I took some work home one evening, and it was just some paperwork and record keeping. So I was looking over some patient records and was trying to find a particular patient's phone number and address. And I could not find it on the form, and so I started going through some of my other papers thinking maybe I just, put it in the wrong folder or wrote it down somewhere else. So I went through this several times, and then finally it dawned on me, this woman's homeless. That's why I have no address or telephone number written down there. What it reminded me of is that this is what our patient population is. We deal with people who I can't even always pick up the phone and call them. We have to come up with other ways to stay in contact with our patients and meet them where they are. Sometimes it might mean we're going to a shelter, or we're going to somewhere we know that they're staying with someone. But again, that's what we can do because we're small, and that's what our niche is.